What if everything you thought about your health was missing the most critical clues? Millions struggle with unexplained fatigue, weight gain, and hidden risks. But simple blood tests hold the key to uncovering these silent problems. Today, we'll reveal the essential tests that can transform your health journey. Welcome to Levitas. 1. Complete blood count. The complete blood count, or CBC, is one of the most fundamental blood tests for assessing your overall health, and it measures key components like red blood cells, white blood cells, hemoglobin, hematocrit, and platelets. These values help detect conditions such as anemia, infections, inflammation, and clotting disorders. For example, low red blood cell counts could explain fatigue, while elevated white blood cells often signal infection or immune activation. A CBC provides a snapshot of your immune system status and oxygen-carrying capacity, giving you essential clues about your health baseline. Regular CBC checks are critical for early detection of many health issues. 2. Blood glucose. Blood glucose testing measures the amount of sugar circulating in your bloodstream at a given moment. Glucose is one of your body's primary source of energy, but when levels become consistently high, it signals insulin resistance or diabetes. Monitoring fasting. Blood glucose helps identify early metabolic problems before symptoms appear. Normal glucose levels vary, but generally should be under 100 milligrams per deciliter fasting. Elevated glucose can lead to serious complications like heart disease, nerve damage, and kidney issues. Regular blood glucose checks empower you to catch and manage blood sugar imbalances early, laying the foundation for optimal metabolic health and weight management. 3. Insulin. Insulin is a vital hormone secreted by your pancreas that regulates blood sugar levels by helping cells absorb glucose for energy. Measuring fasting insulin levels reveals how hard your body is working to control blood sugar. Elevated fasting insulin often indicates insulin resistance, a precursor to type 2 diabetes and metabolic syndrome. High insulin can promote fat storage, increase inflammation, and disrupt hormonal balance. Tracking insulin alongside glucose offers deeper insight into your metabolic health beyond glucose alone. This test can help tailor personalized lifestyle or medication strategies to improve insulin sensitivity and reduce chronic disease risk. 4. HOMA Index. The HOMA Index, or Homeostatic Model Assessment, is a calculated value that estimates insulin resistance and pancreatic beta cell function using fasting glucose and insulin levels. A high HOMA index indicates your body's cells are becoming resistant to insulin's effects, meaning blood sugar regulation is impaired. This test is a powerful tool for identifying early metabolic dysfunction that often precedes diabetes. Understanding your HOMA index helps healthcare providers recommend targeted interventions like diet changes, exercise, or medications to restore insulin sensitivity, optimize energy metabolism, and prevent long-term complications associated with poor blood sugar control. 5. Lipids, ApoA and ApoB-A. Lipid panel measures blood fats including total cholesterol, LDL the bad cholesterol, HDL the good cholesterol, and triglycerides, crucial for assessing heart disease risk. However, apolipoprotein A or ApoA and apolipoprotein B or ApoB provide even deeper insight into cardiovascular health. ApoA is a major component of HDL, protective against plaque buildup, while ApoB is found in LDL particles that can clog arteries. The ApoB to ApoA ratio helps predict atherosclerosis risk more accurately than traditional lipids alone. Comprehensive lipid testing empowers you to make lifestyle changes or treatments that protect your heart and arteries effectively. 6. HbA1c. The hemoglobin A1c test measures your average blood sugar levels over the past 2 to 3 months by assessing glucose attached to red blood cells. Unlike a single glucose reading, HbA1c gives a long-term picture of blood sugar control and helps diagnose prediabetes and diabetes. A healthy HbA1c is typically below 5.7%. Levels above 6.5% indicate diabetes. This test predicts the risk of complications like kidney damage, nerve injury, and cardiovascular disease. Monitoring HbA1c regularly guides adjustments in diet, exercise, and medications to maintain stable blood sugar and protect your organs from damage over time. 7. Electrolytes. Electrolytes like sodium, potassium, chloride, and magnesium are minerals vital for maintaining fluid balance, nerve function, and muscle contractions. The electrolyte panel helps detect imbalances that can cause symptoms ranging from fatigue and muscle cramps to heart arrhythmias and confusion. Proper electrolyte balance is crucial for hydration, blood pressure regulation, and overall cellular function. Imbalances may result from dehydration, kidney problems, or medication effects. Regular electrolyte testing ensures your body's electrical system runs smoothly, supporting optimal energy levels, cardiovascular health, and muscular performance. 8. Kidney panel. The kidney panel evaluates how well your kidneys filter waste and maintain fluid balance by measuring creatinine, blood urea nitrogen or BUN, and estimated glomerular filtration rate. Creatinine is a muscle metabolism byproduct cleared by kidneys. Elevated levels suggest kidney impairment. BUN reflects nitrogen waste levels, and glomerular filtration estimates kidney filtration efficiency. This panel detects early kidney dysfunction before symptoms appear, which is critical since kidney disease can progress silently. Healthy kidneys regulate blood pressure, electrolyte balance, and toxin removal. Routine kidney panels help monitor risk factors like diabetes and hypertension to preserve long-term kidney health. 9. Liver panel. A liver panel tests enzymes and proteins that reflect liver function and damage. It includes ALT, AST, alkaline phosphatase, bilirubin, and albumin. Elevated liver enzymes like ALT and AST may indicate inflammation or injury from fatty liver, infections, or toxins. Bilirubin levels assess how well your liver clears old red blood cells, and albumin shows protein production capacity. The liver detoxifies chemicals, metabolizes nutrients, and produces important proteins. Early detection of liver dysfunction helps prevent serious diseases such as cirrhosis or liver failure. Regular liver panels support maintaining this vital organ's health and metabolic balance. 10. Gut health panel. The gut health panel evaluates digestive function and the balance of beneficial and harmful bacteria in your intestines. It can test for intestinal inflammation markers, dysbiosis, pathogenic infections, and digestive enzyme levels. A healthy gut microbiome is essential for nutrient absorption, immune function, and preventing inflammation. Imbalances contribute to symptoms like bloating, diarrhea, constipation, and even systemic diseases. By identifying microbial imbalances and inflammation, the gut panel guides personalized diet, probiotics, or treatments to restore a balanced gut environment. Optimizing gut health through testing supports overall well-being, immunity, and even mental health. 11. Vitamin D. Vitamin D testing measures serum 25-hydroxyvitamin D, the active form critical for bone health, immune regulation, and inflammation control. Deficiency is widespread and linked to fatigue, muscle weakness, increased infection risk, and chronic diseases like osteoporosis and autoimmune disorders. Optimal vitamin D levels vary, but generally range from 30 to 70 nanograms per milliliter. Testing guides appropriate supplementation and sun exposure recommendations. Adequate vitamin D supports calcium absorption, modulates immune responses, and improves mood. Regular vitamin D assessment is crucial to prevent deficiency-related complications and maintain optimal overall health, especially in those with limited sun exposure. 12. Ferritin and iron. Ferritin reflects the body's iron storage, while serum iron measures circulating iron available for making red blood cells. Iron is essential for oxygen transport, energy production, and immune function. Low ferritin or iron causes anemia, fatigue, and cognitive issues, while excess iron can damage organs. Measuring both helps diagnose iron deficiency anemia or iron overload disorders. Ferritin is especially important as it indicates chronic iron status, not just recent intake. Proper iron balance supports optimal energy, mental clarity, and immune defense. Testing guides dietary adjustments and supplementation for personalized, effective iron management. 13. HSCRP. High-sensitivity C-reactive protein, or HSCRP, is a sensitive marker of systemic inflammation in your body. Elevated HSCRP levels signal chronic inflammation, a root cause of many diseases including heart disease, diabetes, and autoimmune disorders. Unlike standard CRP, HSCRP detects even low-grade inflammation that may be silent but damaging. Regular HSCRP testing helps assess cardiovascular risk and monitor response to lifestyle changes like diet and exercise. Lowering chronic inflammation through targeted interventions can significantly improve health outcomes. This test is a powerful tool to catch hidden inflammation and protect long-term health proactively. 14. Urine. Urinalysis is a simple, non-invasive test evaluating kidney function, hydration, infections, and metabolic conditions. It examines urine color, concentration, presence of glucose, proteins, ketones, blood, and bacteria. Urine testing helps detect urinary tract infections, diabetes, kidney disease, and dehydration early. It also indicates metabolic imbalances like ketoacidosis. Regular urine analysis complements blood tests to provide a fuller picture of your body's waste elimination and metabolic health. Monitoring urine health supports early intervention, prevents complications, and promotes optimal hydration and kidney function. 15. Thyroid panel. The thyroid panel assesses thyroid gland function by measuring hormones like TSH, free T3, free T4, and thyroid antibodies. The thyroid regulates metabolism, energy, body temperature, and weight management. High or low thyroid hormone levels can cause symptoms like fatigue, weight changes, mood swings, and temperature sensitivity. Antibody tests detect autoimmune thyroid conditions like Hashimoto's or Graves' disease. Early detection through thyroid testing is crucial to prevent metabolic disturbances and optimize hormonal balance. Regular monitoring helps guide hormone replacement therapy or other treatments, supporting energy levels and overall metabolic health. 16. Men and women's specific tests. Certain blood tests target gender-specific health concerns. For women, estradiol, progesterone, FSH, and LH evaluate reproductive health, menstrual cycle, and menopause status. These hormones influence fertility, bone health, and mood. For men, testosterone, free testosterone, and prostate-specific antigen or PSA tests assess hormonal balance, muscle mass, libido, and prostate health. Monitoring these hormones helps detect imbalances that affect energy, weight, mood, and aging. Gender-specific blood testing guides personalized treatments to optimize hormonal health, enhance vitality, and prevent chronic conditions related to reproductive and endocrine systems. In conclusion, understanding key blood tests like CBC, blood glucose, insulin, lipid panels, vitamin D, and thyroid function unlocks the door to optimal health and early disease detection. Regular monitoring empowers personalized strategies to improve metabolism, immunity, cardiovascular health, and hormonal balance, helping you achieve lasting wellness and vitality. Thank you for tuning in to Levitas. Please share today's video with friends and family, give it a thumbs up, subscribe, and hit the bell icon to receive notifications for future videos. Your support is appreciated. It helps us grow and create more content to empower your health. Remain tuned to Levitas for more expert advice on your health and fitness journey. So stay healthy, stay happy, and keep going.